There isn't an app for healthcare today that we all use, which makes accessing doctors more convenient and cost-effective. Hi, my name is Sean, and I'd like to offer you one diagnosis of the problem tech has had in engaging consumers around a new way of accessing care, and I'd also like to offer a prescription for fixing this. We've seen time and time again how technology has the power to transform marketplaces and significantly improve the consumer experience. Airbnb did it with lodging, Uber with transportation, Amazon with commerce, and Netflix with entertainment. And in each of these cases and countless others, the playbook was consistent. These tech platforms created convenient 24/7 access to a marketplace using some app or website. They then created a large selection of supply and used algorithms to efficiently match you to the best supply for you. And finally, they seamlessly fulfilled a transaction by booking that room, bringing you the cab, sending you the package, or playing your movie, streamlining the entire process from search to payment to consumption. But wait a second. Healthcare is a marketplace too. The demand are the billions of people every day who have some health question or concern. And supply is our precious pool of highly trained doctors, nurses, and specialists who have accumulated the knowledge and training to give us the answers and treatments we seek. And the marketplace is totally broken. It's plagued with soaring costs, which continue to grow at unsustainable rates. The consumer experience is as confusing and complicated as ever, with difficulty finding helpful information online that you can trust, finding the right provider who can help you, scheduling an appointment at a reasonable time, and figuring out how much all of this will cost and who's going to pay. And finally, our precious few doctors are overstretched, managing larger patient populations, and experiencing burnout more than ever. So let's try to understand why. Like any good economist would, let's put this marketplace in the context of a supply and demand graph. The first issue in healthcare is that demand is price insensitive. That means we need healthcare when we get sick, regardless of how much it's going to cost. Second, the supply is also fairly price insensitive. That means we can have as many doctors as we have. Raising the price of healthcare doesn't lead to more people becoming doctors overnight. And where supply and demand crosses, well, that's how much healthcare costs. Now, what's happened over time is that demand for healthcare has increased significantly. Our population is growing, people are living longer and managing more chronic conditions, and there's an explosion of data and an unending series of administrative tasks that our doctors need to handle. Unfortunately, in that same time period, the number of doctors who can service these people and tasks has not increased at a sufficient rate. It takes a lot of time to build medical schools and graduate a new cohort of doctors. So the result? Well, the price increases a lot. And to top it off, each transaction in healthcare is full of friction, both for the consumer and the doctor. So then surely, technology must be the answer. Because, well, with technology, you can actually reduce the demand by giving consumers better tools to self-triage and self-treat, training apps and algorithms to automate the simple, high-volume aspects of care. Fantastic. Technology can also effectively increase the supply for care by removing the constraints on our physicians. Telemedicine, for example, removes geographic constraints and gives consumers access to otherwise available doctors who are not physically near them. AI can remove time constraints from doctors, freeing them up from mundane tasks like interviewing patients and documenting their visits, allowing them to see more patients during the day. The result is, of course, a reduction in cost, not to mention happier consumers and happier doctors along the way. And then, of course, technology can also remove that transaction friction around finding the right care, booking it, and paying for it, making the entire marketplace operate even more efficiently than before. So then, why hasn't tech transformed care yet? Well, to put it bluntly, we've failed to engage consumers with tech that they'll actually use and love to use. There's definitely been attempts, but they've all fallen short for different reasons. There's been a whole class of health record platforms that provided no real utility to consumers. Once the novelty of journaling your health wears off, We usually get bored of the app because we fail to see the benefit from all that high-effort record keeping. Then there's been tech that doesn't provide enough utility to us. For example, online health information websites usually leave us more confused and anxious than before. Finally, there's plenty of tech that doesn't provide utility frequently enough in our lives. For example, platforms that make it easier to see a doctor online or in person aren't really useful more than the once or twice a year that most people get sick. As a result, these solutions understandably don't get used much. But when you stop and think about it, it's not intuitive. An Uber for healthcare makes a ton of sense. All consumers want fast and convenient access to doctors. There should be some company growing like gangbusters, buying TV commercials, billboards, and Facebook ads promoting such a compelling value proposition to consumers. So why doesn't it exist? Is it really that hard? Well, kind of, yes. And it starts to become clear when you compare it to Uber itself. So first of all, think about how often you need a ride versus how often you need a doctor. Transportation is something you need almost 25 to 50 times more frequently than care. Second, each transaction also costs significantly more in healthcare than in ride-sharing, almost 10 times more so. Third, the labor needed, doctors, are significantly harder to recruit and more expensive to compensate than drivers. Next, the virality is a lot lower. You don't brag to your friends about how wonderful your private doctor visit was. And finally, payment friction is very high. You just don't pay for care with your credit card. We usually need our insurance company involved, and then you're dealing with reimbursement claims and co-pays and lots of fine print on your policy of what's covered. And finally, there's the unit economics. It's really expensive to buy ads to get more users. And the only way to scale up is to make sure you make more money from each consumer than it cost you to buy the ads that acquired them. Unfortunately, when you're selling 2 to 4 doctor visits a year, and most of that income is going to paying the doctors for their time, you're not left with a lot of profit to fuel your marketing spend. But there may be solutions here, and lessons we can draw from our Uber analogy. For one, you want to find multiple ways to generate revenue from your platform. Uber's doing it by going beyond ride sharing and selling you food delivery, freight delivery, scooter rides, bikes, and more. A healthcare platform could do the same by going beyond just doctor visits and generate revenue from steering you to the right medications, devices, tests, and other goods that consumers need to buy. And secondly, and perhaps more importantly, the more we can use AI to automate the very expensive parts of the transaction, human time, the more profitable such an endeavor would be. And much like Uber is investing in autonomous vehicles to reduce the dependence on paid human drivers, healthcare also needs to find ways to reduce our dependence on paid human doctors. Okay, so enough with the challenges. Let's be positive and talk about solutions. If we want to engage consumers on a technology platform, what do we need to do? So here's a thought. Let's not build software and then try to change consumer behavior to conform to the way the new software works. Instead, how about we change our software and conform it to existing consumer behavior? Okay, so where do we start in designing such a tech platform? Well, let's start where consumers start. Where do we all turn when we get sick or have some kind of health question? Is it our insurance company website or hotline? Is it immediately heading into a doctor's office and waiting room? Do we stroll into the local drugstore? Or do we first try to download some new app? Think about your own personal experiences. The reality is that many of us start by searching the web. In fact, we do this almost 20 times more frequently than seeing a doctor. And we do it to get access to information to orient us way before we decide we want to talk to a doctor. There are almost 10 billion searches related to health questions and symptoms on Google each year compared to only 500 million doctor visits. And yet, that usually just makes things worse. For one, when you search your questions online, search engines have no context of your history or profile, so inevitably your question about a headache leads to articles about brain cancer, making you worried more than you need to be. Secondly, there isn't always the right content. People often have pretty specific questions, and you end up with articles that don't address your specific needs adequately. Search engines can only find what's out there. And finally, there's no trust. So if you do end up finding a specific answer to your specific question in some online forum, it's usually written by some anonymous stranger. And that leads to problems like we see today, where people mistakenly believe that vaccines cause autism and we should be throwing chickenpox parties to infect our children. And Google admits to these inherent flaws on their own blog, citing that web content can be difficult to navigate and tends to lead people from mild symptoms to scary and unlikely conditions, which can cause unnecessary anxiety and stress. So we've established that there's a behavior that consumers have that is 20 times more frequent than seeing a doctor. And that behavior of seeking health information is a huge pain point. Can we design a solution that relieves this frequent pain? Well, we can if we design a solution that serves information with all of the characteristics that consumers value. That is information that is personalized, that is trustworthy, and that is fast and free. However, today, if we want a personalized and trustworthy answer, the ultimate source is, of course, still real human doctors. But if we want information that's fast and free, as many of us do, we're usually trading off one of the other two things. So if you want fast and free and trustworthy, you end up on a reference website or an encyclopedia online that gives you trustworthy content, but it's not a personalized answer to your specific question. But if you want a personalized answer, you usually end up on some online forum, and then you lose the trustworthiness of the content. So the ideal solution is something that can generate knowledge and information that has all of these characteristics. Okay, so that seems obvious enough. But then why haven't incumbents like WebMD already built something like this? Well, it's because it doesn't make economic sense with the current business model. Let's take a look at the graph of people's online health queries from generic questions all the way to very specific questions and how much consumers demand answers to those questions. You can see that a lot of people do ask very simple, basic questions that you can often find in an online encyclopedia. However, there is a very, very long tail of highly specific questions that individually don't have much demand, but collectively make up most of consumers' demand for health information. For these generic questions, the business of online content publishers makes sense. You can employ medical writers to create articles for a fee, but make up more than that fee in the ads that are served on these pages that generate a ton of traffic. However, for those very specific questions, you need increasingly expensive experts to publish their very domain-specific knowledge. And since each article would generate little to no traffic individually, it wouldn't be a profitable endeavor for these businesses to pay those specialists to create that content. So consumers are left without a good solution for this long tail of health queries, which account for most questions people ask. We need a complete solution. So is it even possible? Well, there are models to generate high quality content in the full range of people's questions, and it's been done before. Think about it. Quora is an example of a platform where people submit their questions, generic or specific, and a crowd of experts generates answers at no cost. They get the satisfaction of helping people, but they also enhance their online reputation and visibility as an expert. Stack Overflow is another example where developers answer questions for free about programming and learn from each other. So can there be a similar model for doctors who publish their knowledge to any health question for free, helping consumers, enhancing their reputation and visibility amongst patients and colleagues, and learning from one another? It certainly could make sense. And with all this massive data being generated around what people are asking in context of their health profile and how medical experts are answering and rating each other's answers, You can ultimately train an AI to automate answering common questions. Common questions like, what explains my symptoms and what should I do about it? And in fact, the AI can even automate the menial doctor tasks like conducting the patient interview and taking a full history, saving the human doctor a ton of time down the road. The AI can also go beyond to triaging consumers to the most effective care option for their situation, preventing a lot of unnecessary utilization of our precious supply of ER, urgent care, and doctor time. So is that it? Would that be enough to build an engaging tech platform for consumers? Well, no, because some percentage of the time, consumers will still want to go from researching a topic to speaking with a doctor for an actual diagnosis, referral, or treatment. So what do we do in that case? Well, that's where telemedicine and online provider directories and scheduling tools make sense. Once you've hooked consumers in around health information, you have their attention to navigate them to efficient means of accessing care, virtually or in person. And why stop there? Isn't there an opportunity to also add value to consumers after or between doctor visits? Of course, we can create experiences which actually stay with the consumer and send them helpful, timely reminders, what medication to take or exercise to complete, and continuously monitor them to make sure they stay on track to getting better or staying well. Fantastic. So we just described a system that starts by engaging consumers on a frequent behavior and common pain point of seeking health information. And then in step 1, that system makes answers as cost-effective as possible using crowdsourcing and machine automation. In step 2, if and when needed, consumers that seek care can do so cost-effectively and efficiently with telemedicine. And if truly necessary, they can be referred to the right specialists and facilities for in-person care. Finally, in step 3, that same platform helps them after the doctor visit with reminders and tracking and connects them to the medications, tests, and other goods they need to consume to get better or stay well. And built intelligently, the system would continuously learn and improve as more people use it, getting more accurate, more efficient, and more personalized at scale. So at this point, I'm sure many of you are thinking, this stuff already exists. There's nothing new here. And there are tons of apps that do exactly this. And you're totally right. The reality is, however, that when consumers have a health question today, they do turn online. And they end up on one of the many sources of online health information that often prove inadequate and often exacerbate the problem. Then, when it's time to get help, consumers are left on their own to find a tool to help them speak with a doctor online or in person. The options are overwhelming and confusing. And once the visit is over, it's time to manage their health on an ongoing basis, taking action. And once again, consumers are left on their own to sift through the thousands of niche apps completely disconnected from the visit they just had and the information they just read. Worst of all, none of these apps share data or coordinate to get smarter based on your experience with any of them. There is not one unified understanding of your health profile, what's working, what's not working, to help this end-to-end experience improve over time. And to make the analogy back to Uber, imagine a disjoint transportation experience like the experience we have in healthcare today. Imagine a world in which you call the taxi dispatcher by phone and wait without clarity for a cab who will arrive at some unknown time. Then you re-enter your location in Google Maps to help you and your driver navigate and avoid traffic. Then you take out your credit card and hope you're charged the price you were quoted. And finally, you provide feedback to some taxi customer support email, hoping you don't get such a poor driver again in the future. Man, what a hassle. Then enter Uber. The same exact consumer flow, but seamlessly connected, and with feedback loops that make the network and experience better each time. That's what healthcare needs. If we're going to build the Uber for care, we need to think about streamlining the whole journey end to end, not giving thousands of apps to help with different aspects at unknown times in unknown ways, but a unified end-to-end flow that takes consumers from the moment they have a question or concern all the way to the moment that they're feeling better and frictionlessly navigates them across every step in between. In fact, the best way to think about the opportunity for such a tech platform would be to become the ultimate consumer destination for seeking care online, or in other words, a digital front door to care with a connected consumer journey to follow. Such a platform would attract consumers and then use a combination of AI and human doctors to give you the information and care that you seek. If and when needed, it would guide you into the most appropriate hospital or specialist. When it came time for you to purchase a test or medication or diapers or a heat pad, it would help you obtain that too. And each time you had to pay for a service or good, it was connected with your insurance company to make the payment process transparent and easy at each step. Any tech platform that successfully engages consumers as this front door will have a unique power in steering consumer demand and routing it within a marketplace of goods and services. In many ways, it's analogous to what happened in the market for online content 20 years ago. You had incumbents like Yahoo who said to consumers, if you want online content, we have it. Come to our platform, find what you like, consume what we created. It'll be great. But then came along Google that said, there's no way we can create all the content in the world. We're going to let the marketplace create all the content that consumers demand. We're just going to solve one software problem really well. And that's understanding what consumers demand in the form of a search query, and then algorithmically matching consumers to the best content from that marketplace. Similarly, we live in a world where payers and providers tell consumers to buy their goods and services from them and stay with them. Instead, perhaps there can and should be one tech platform that solves one software problem really well, which is to understand what consumers demand in the form of their health queries and algorithmically matches them to the best answer, doctor visit, healthcare good, or service in an open marketplace of those who provide them and pay for them. And guess what? I will admit this is an hypothesis that we've been testing at HealthTap for the past 8 years. And I have to say the results are promising. When you create an end-to-end experience, consumers do love it. And we've seen NPS scores in the high 60s, commensurate with some of the more engaging consumer tech products out there that we love, like your iPhone or Netflix. We've also seen that consumers use it significantly more than they'll use, let's say, a telemedicine-only app, almost 17 times more each month. And initial research also shows that such a platform can significantly reduce healthcare costs by preventing unnecessary ER and doctor visits. And building such a solution really requires thinking holistically and comprehensively, bringing a full suite of capabilities together in a unified platform, from records to information to telemedicine to scheduling to directories to payments to notifications, all interoperating and working in unison. But if and when we build such a thing, the benefits are massive to all parties in the marketplace. Consumers would get fast, convenient, high-quality access to care that leaves them happier and healthier. Payers will see their costs go down, and providers will enjoy happier doctors and a more efficient and productive operation. And to put the business opportunity in perspective, Amazon sees somewhere between $500 to $1,000 in revenue for each US consumer annually. In healthcare, consumers spend $10,000 to $12,000 in goods and services each year, in order of magnitude larger than one of the largest tech companies in the market today. Such a tech platform that aggregates a significant amount of consumer demand in healthcare can also become one of the largest businesses. So if that's the playbook for consumer engagement, who's going to execute it? Is it going to be the consumer retail companies? They certainly have tons of consumers and know how to market goods and services to them. Perhaps they can get in the business of selling healthcare. Or will it be the consumer tech companies? Not only do they have and understand consumers, but they also know how to build technology that consumers use and love. Maybe it'll be the enterprise software companies that not only know how to build a tech, but they know how to work with large enterprises like payers and providers to deeply integrate within the healthcare infrastructure. Perhaps it'll be one of the enterprise cloud companies who are already being entrusted with all the digital infrastructure by these payers and providers and can start developing services on top of the cloud. Maybe it'll be the individual payers and providers themselves. I mean, they are, after all, in the business of paying and providing for care, so they may best know how to use technology to fix it. Or maybe it'll be a new startup that has more freedom to disrupt the status quo, but will have to overcome the challenges of scale and mass adoption and building trust with payers, providers, and consumers alike. Well, whoever does it, the world will be forever grateful to you. Because healthcare needs healing, and an engaging consumer technology platform that creates an end-to-end frictionless flow will be the cure. Thank you.